Welcome to Elephant in the Room, a podcast featuring real conversations with real therapists on the elephant in every room, trauma. With this show, we are aiming to share insights from professional practitioners on trauma, its impacts, as well as various modalities and resources on healing for survivors. This podcast is produced by the Breaking Free Foundation, a Canadian registered charity that supports trauma survivors in reclaiming their lives and finding healing. All of the therapists interviewed on this podcast are members of the Breaking Free Foundation Trauma Practitioner Network. My name is Amber Craig. I am a trauma survivor, one of the co-founders of the Breaking Free Foundation, and the proud host of this podcast. Today, I'm pleased to be joined by Shayla Dube. Shayla is a clinical social worker at Wellness Empowered in Alberta. She is passionate about the collective healing of historical, childhood, intergenerational, institutional, cultural, and personal traumas. Please welcome to the podcast, Shayla. Thank you for being here today.
Oh, thank you for having me.
Just to kick off right off the bat, I'd love to just give you an opportunity to explain more about yourself and your background and give us a little more of an in-depth introduction.
Thank you. I'm a registered clinical social worker. I have been practicing for the past 13 years, and 11 of which have been in mental health, and 2 of those 13 years were in child protection. So I've been working primarily with children, youth, and their families for the past 11 years with AHS. And in private practice, I do work with adults and families as well as organizations. I'm a psychotherapist, but I also have other roles, other hats that I wear. I like to see myself as multi-dimensional. I am also a professor, sessional professor with the University of Calgary. I've also guest lectured in other universities across Canada. In my private practice, I specialize in using trauma-informed or trauma-responsive as well as culturally responsive methodologies. That means that beyond the mainstream approaches, I look into weaving in other indigenous ways of knowing. And I want to be clear that when I say indigenous, that also include African indigenous, since I am African. So from an Afrocentric perspective, and identity-based trauma is one of my specialties. That means that I do work with people from equity, deserving, and seeking groups, and ensuring that within their intersectional identities, the approaches that I'm using are culturally affirming as well as responsive to their unique needs. So I think that's an okay intro.
Yes, absolutely. You briefly touched on this, but I did want to expand on it just a little bit for those who may not know what culturally responsive therapy is. Could you go a little more in depth and explain, like maybe some examples of what that could look like?
Right. Well, I think that before we look at what cultural responsiveness is, we're going to look at what culture is. So culture encompasses beliefs, values, norms, and customs and traditions um, within a group of people, and it also shapes how people perceive the world. It can also include language and food and social etiquette and what have you. So when we look at that definition of my brief definition of culture, in our work as psychotherapists, we want to make sure that we're culturally affirming, we are practicing from a cultural humility perspective. That means that you walk into people's spaces knowing that they are the wisdom keepers of their own cultures. So being culturally responsive means that you're able to tailor your methodology approach to meet people where they are in ways that are digestible to them through their own worldviews. So I see cultural when I say cultural responsiveness or being culturally responsive, that's exactly what I mean. That you can, me as an African person, if I am working with an indigenous person, I'm walking in as a student of their lived experience, not as an expert. So being culturally responsive means that I am walking in there knowing that I'm going to learn from them how to work with them in ways that are affirming of them, in ways that are not further oppressing them, in ways that are that leave them feeling seen and not feeling like they are parts of their identities that they have to hide when they are in my care. So, in a nutshell, I think I see cultural responsiveness as being able to modify or integrate other ways of knowing in the approaches that we're trained in, if that makes any sense.
It does, absolutely. When would you say culturally responsive therapy is really beneficial for clients?
I think all the time because, as I mentioned, that we all have intersectional identities. So when I come into your therapy as a person, for instance, I already gave the example that I'm African. I am African. I'm a woman. Um, there are other petals of people's identities that they bring to the table that you gotta be able to respond to. So when we talk about being culturally responsive, that is an approach that we have to think about or integrate all the time that we're working with people, knowing that people do have uh, various aspects of their identities that need to be catered for or need to be considered if your approach is going to be holistic. So I gave an example of working with indigenous people, but we can also be gender affirming when we're working with gender diverse or sexually expansive folks. We can be neuro inclusive and neuro affirming. So I see all of those as examples of being culturally responsive, that when we're working with people, we are looking at their various identities and how we can cultivate ways that make them feel comfortable enough to share whatever it is that is impacting them.
Your website references a few different types of therapy modalities that would be considered culturally responsive, and I just wanted to go through a couple of them for people who may not know, starting with Tree of Life narrative therapy. Can you walk us through what that is?
Okay. Um, so I found out about Tree of Life in 2020. I think during 2020, there was a lot of political unrest. There was a lot happening in the world that made me feel like as a clinician, I wasn't properly trained, or I didn't have all the tools that I needed to work with the people that I was working with. So that's how I found Tree of Life. So Tree of Life is an Afrocentric narrative therapy that blends narrative principles with African indigenous ways of knowing. So it uses the tree metaphor to look at different aspects of people's lives. Um, the example being that if people come to you and they are already struggling with a certain area of their life, in in a tree of life approach, we have what we call islands of safety. That means that instead of leaving people where they are, you want to make sure that you bring them to islands of safety before you can look into what storms are they going through. So that's how the tree of life process starts. Um, and when they are drawing their tree, and the roots represent an aspect of their life in terms of identity, heritage, cultural traditions. So whatever people consider as their roots, it could be language, it could be their cultural food, and what have you. And then the ground of their tree represents the current life, like where you are at the moment. So meaning I am grounded in Canada. I am grounded in Vegreville where I live. So people will be identifying part of their now, the here and now. What makes you feel grounded? Where do you live? Maybe there's a part in your living maybe there's a part in your house that you find comforting, that you go to when you're overwhelmed and things like that. So that's the example. So they're identifying as so that's the ground of the tree, and then there's the trunk. The trunk represents people's skills and values, and that's actually the part that people often struggle with. uh, Interestingly, even clinicians as well, because before you can use Tree of Life, you got to draw your own tree in training as a clinician. So oftentimes we are good at seeing other people's strengths, but we often struggle with saying, I'm good at this or I'm good at that. So it's often telling when we ask people to identify what they are good at. And then the branches of the tree represents hopes and dreams. So, and aspirations. Again, as people are drawing their tree, they are labeling what are their hopes and dreams. Maybe your hopes and dreams in the next year, or your hopes and dreams in 5 years, or maybe that's the time that people get to say, "Oh, when I was a little girl, I wanted to be this," and they're going down memory lane and maybe realizing when did this dream uh, weasel out, or maybe they are living that dream. So they're really just going down memory lane as they're drawing their tree. And then um, the leaves of the tree represents the most important people in your life. However, we emphasize that the leaves of the tree can be fallen leaves, meaning people that are no longer here, because people do not stop being important to you because they are no longer physically here. They could be still your spiritual anchors. They could be your ancestral resource and things like that. Um, and then the fruits of the tree represents the gifts that have been given to you, and those gifts can be material gifts or in-kind gift. And oftentimes when we are wrapping up that tree, we say to people, you can look at every area of your tree and identify what gift you have received from any, just in case people are struggling. And then we end, so because Tree of Life is a community-centered approach, it's not an individual, although it can be adapted to be an individual psychotherapy tool. After drawing the tree, they will do what is called the Forest of Life, where they stick all their trees together. So which again has that resonance of community, of having your story witnessed by others. And also when you're just glancing through, you realize that everybody has a story, that I'm not alone in my struggles, or I'm not alone in whatever I'm going through. So that would be called the Forest of Life. And when we look at trees, they also coexist in a forest, even as in their differences and in their similarities. And then after that Forest of Life, then they will grow, they will then go through the storms of life. This is the part where now they look at what we will call the presenting problem. So in a mainstream approach, we would have probably just gone through the presenting issues already. And what happens is that when we go straight to presenting issues, there's oftentimes a possibility of just leaving people drowning, because um, they are saturated in that problem story, which we call the single story. So when you're in Tree of Life, you're helping people step into their, what is called in narrative therapy, the secondary story, their preferred story. So then they look at the storms again. They are defining what the storms are. I'm not sitting here as the therapist saying, this is what you've gone through. This is what the storm is. They are defining what their storms are. So then after, obviously, as they are identifying their storms, you're also helping them figure out what it is that they did to go through those storms. So as people are identifying their storms, they are also identifying their strengths and resources, and what it is that they have done to get through those storms. And then it ends with a celebration, where if it was a group, then they will be getting a certificate, and it will be some sort of a ceremony where they are now celebrating that they have gone through this process of going down, of looking at different areas of their lives, and they are still standing together. So, in a nutshell, that is Tree of Life. But like I said earlier on, that it does it's centered on a narrative principle. So if people were probably, if you met somebody who's not ready to draw their tree or explore Tree of Life conversations, we will do what is called externalizing conversations. And the externalizing conversations of narrative therapy also have different steps where people are characterizing their problems and mapping out their problems, because in most cases, the problem saturated story is often the internalized version of people, where they will struggle to separate themselves from the problem or their identity from the problem. So, what Tree of Life does is actually helps people to separate themselves from the problem or separate themselves from the diagnosis, because in mainstream approaches, there's often a tendency to pathologize people where we give them labels. Um, and then sometimes people wear those labels as if it's part of their identities. And you hear people saying, oh, I'm ADHD, I'm depressed, I'm this. And so, what the externalizing conversations helps people do is, okay, I hear that you're depressed, which is a medical term. If we were to look at it through your lenses, what would you call that? So, again, we are using those metaphors for people to name their storms. And sometimes you hear people saying, oh, it feels like a dark cloud. That's often the metaphor that people use when they are depressed. And sometimes you hear, oh, it feels like a tsunami, which again, it gives you an insight into people's world from their own words and their own experiences, as opposed to you using medical terms to describe people's struggles. And I hope that gives you a sense of what Tree of Life is in a nutshell. You did say other modalities. So obviously, Tree of Life is one of the many. I'm also trained in EMDR in color, which is a basic EMDR, but it had the touch of it had the touch of cultural traumas and racial traumas. And like if you were working with people from equity, um, deserving and seeking groups, how you would tailor the modality to respond to those needs. So EMDR in color is one of those approaches that I would consider to be culturally responsive. But again, in going back to the Afrocentric narrative therapy, there is narratives in the suitcase. And narratives in the suitcase was designed. Funny enough that I've talked about Tree of Life without paying tribute to the person who actually designed it, which is an African woman in collaboration with, her name is Shayla Dube, and she designed Tree of Life in collaboration with David Dunbar from Australia. She's also the one who developed narratives in the suitcase. And narratives in the suitcase is, unlike Tree of Life that uses the tree metaphor, it uses journey metaphors. And it was designed to respond to transitions like migration. So it will look at pre-migration and post-migration traumas, but it also can respond to other life transitions that have nothing to do with traveling. So when people are going through different transitions, but you're just using journey metaphors to unpack different areas of their struggles. There's also courage, spelled with two R's, and courage is also an Afrocentric narrative therapy group approach that is designed to respond to extensive trauma amongst girls and women, and obviously gender diverse people. And outraged. Also, I think it has two R's or two T's. I can't remember, but it's spelled in a different way. And it's also a group approach. It's 11-week program that is meant to respond to men and boys' mental health matters, and also respond to gender-based violence. So in a nutshell, those are, I'm also trained in NIFLI racial trauma therapy, um, which I also appreciated again because it does break down racial trauma, and it's also a group approach for both youth and adults. So I'm just going off memory here. And since I mentioned intersectionality and others, the Dalwish Center, where Nazelo, the Tree of Life person, partners with, they have a lot of online trainings, and that's where I trained in narrative therapy with Indigenous people. There's also narrative therapy for queer people as well. So they have those approaches. So depending on one's expertise or comfort zones, I think there's an approach that one can learn from, so that you're not just talking the talk, but you can say, when I'm working with this group, I can tap from this. I can learn this and make sure that I'm not being harmful in the process, or expecting people to be the ones that educate you about everything. I think the wisdom of the story lies within the storyteller. However, we also have a responsibility to learn on our own, if that makes any sense.
Yeah, I think you've done a really great job of explaining um, what the benefits are for a client to really have a tailored therapy experience based on their own personal experience. Can you speak a little bit more to why it's important for therapists to take a culturally responsive approach?
Right. Well, um, to be a culturally responsive therapist requires that you practice from a cultural, humility-centered perspective. Being culturally humble goes back to what I said earlier on, that it's you knowing that I don't know everything as a therapist. And so I'm walking in here with that humility, that I'm gonna learn some stuff from this person that who's coming in to seek to access my services. So if you don't have the cultural responsive lenses, it is impossible for you to cultivate psychological safety. So
Right.
cultural safety precedes psychological safety, which means that if you don't consider that in your approach, you're likely to be harmful when you think you're being helpful. So it's important that we are culturally responsive in our approaches by practicing from a cultural humility perspective. Such, you have to do things as asking people, do you speak another language? What is the way that I can address you? Versus, for instance, from certain cultures, uh, including mine, we don't call um, elders or people that are older than us by their first names. So it's
Mm.
you having that humility to ask people, is there a way that I can address you that's comfortable for you? Is there meaning behind your name? It's those little things that we can do to offer a space that people can feel safe, and asking questions about, oh, how do you um how do people grieve in your community, instead of you coming in with solutions that people need to do ABCD, or they need to do some CBT worksheets, or DBT this and DBT that. So I think that
Mhm.
it's so hence, if we are not considering how we can be culturally humble enough to integrate the cultural responsiveness in our approaches, it's inevitable that we will be harmful and oppressive in our approaches when we are intending to help.
I think that's a good segue into my next question, which is what should a client, look for if they are seeking a culturally responsive therapist?
Right. Um, I want to first say that in as much as for some people it can be helpful to have a therapist that looks like you, that's not always the answer. I can look like you and still not be doing my inner work that makes me a culturally safe therapist for you. So it's
Right.
important that you ask your prospective therapist about what experience do you have in working with people that look like me?
Mm.
What do you know about cultural traumas? What do you know about intergenerational trauma? If, for instance, you are somebody from if you're like a person of African descent, you could actually be specific about what do you know about anti-Black racism and how do you address it in your practice. If you are an Indigenous person, for instance, you could ask about what does Indigenous visibility look like? Do you consult with Indigenous people or Indigenous elders? So I really think it's
Right.
important that people ask specific questions so that um, you can determine if that therapist has the competency to work with you or have they have the experience, or you're going to be an experiment for them where they are um, they are not trained to work with you. Things like racial trauma are an expertise, and it may not be in the DSM, but it does exist and it impacts people, and cultural traumas and things like that. Western psychology tends to be very individualistic and everything.
Mm.
So it's important that when you're looking for a therapist, you ask them certain questions about collective trauma, cultural traumas, um, institutionalized trauma, and so forth. So I think that in most cases, our bodies know when you feel safe with somebody. That's another thing that you gotta trust when you're in a space with somebody. How do you feel? Trust your energy, trust how how they are talking to you. Are they coming across as they are the expert that have all the answers, or they are coming across as, you know what, I've worked with people that look like you, but I do know that your story is a unique one, and I may not know about specifics that you've encountered, but I'm hoping that I can walk alongside you and bear witness to your story and hold space, because our job is really to hold space and bear witness. And I think there's no expectation for us to know everything, but there's that responsibility that we are transparent when we don't know something, so that we're not coming across as we are fixers who can fix
Mm.
every problem in front of us. And I think it's impossible to be an expert in everything.
Yeah, absolutely. Um, you've given a lot of great information about this for anyone who's not familiar. Do you have any resources that you recommend for people if they want to learn more about culturally responsive therapy?
Okay, since I have particular trainings that I mentioned, for like Tree of Life, Courage, Outrage, the Narrative in Suitcase, if people can go to Paula website, which is POPHOLA.org, they will likely to have the many trainings that I listed. However, we have partnered with that organization. So if you go there, they're likely going to send you back to Canada and say, hey, if you're in Canada, maybe contact Shayla. So we've partnered with them to bring those trainings. We have them from time to time, the ones that I listed. And then the Nifley racial trauma therapy, I think it's Dr. Stephen Nifley. Again, if people search for him, they can find his website, and that training is actually self-paced. I enjoyed it, and I still go back to the resources for that particular training. I also mentioned the Dalwish Center. They are in Australia. They have the indigenous narrative therapy, the queer narrative therapy, and I think there's other variations of cultural responsiveness there from their website. And their trainings are also free. You only pay if you want a certificate. And there's also, I don't believe that the EMDR in color still exists. However, there are many trainers that do have that expertise of weaving in the cultural traumas and racial trauma and intergenerational trauma and so forth. So you want to make sure that you're doing your job when you're looking for a trainer to see what perspective and lenses will they be teaching you from, if that's what you're looking for, if you're looking into weaving in some cultural responsiveness to your practice.
That's great. We'll definitely put links to all of those resources you mentioned in our show notes. Do you have any other favorite trauma resources on trauma in general?
Um, I like the Embody Lab because they are a hub for various trauma aspects. I've seen Peter Levine there. I've seen some of. I've never. I'm never able to pronounce the. Is it Gabor Mate? I don't know.
Gabor Mate, yeah.
I, I always butcher his name. So they're a hub for various aspects that they bring in for their various trainings that they do. They teach from an integrative somatic trauma perspective. So meaning they really do. They have Schwartz for IFS and various Hakomi and so various aspects of responding to trauma. So I like them for that perspective that you won't find one aspect, but you will find various teachers and various resources from there. I also like Tama Bryant as well as a culturally responsive psychologist. She's from the US, but I think she partners with various organizations. I've seen her on YouTube and other social media platforms.
That's excellent.
Oh,
This has been a really, really informative conversation. I really appreciate your perspective on this. Is there anything else you would like to share before we close today?
um, I think that it's important that we decolonize our ways of knowing, our ways of being, and our ways of doing, um, and realize that in as much as certain modalities do have the funding and the buzz, sometimes the same modalities can be not as effective to certain groups. I give that example as CBT is really well known and well advertised, but I can't imagine that we can CBT our way out of a genocide. We can CBT our way out of intergenerational traumas. I do think that it's important that a CBT approach can be trauma informed. So it's not really about this or that, but it's more like this and that. So meaning in your CBT approach, what else can you integrate that can make it safer for certain groups? So, and I think that really boils down to it, the integration piece.
I think that's very well said. That's the perfect note to end on. I really want to thank you for being on the show today and hearing your expertise on this topic. If anyone is looking for more information about Shayla and her practice, please see our show notes. The Breaking Free Foundation offers therapy grants for trauma survivors in Alberta, and we also host 2 free support meetings a month. One is in person in Calgary, and one is online. For more information on trauma therapy and our organization, please visit us online at breakingfreefoundation.ca. If you enjoyed this podcast, please subscribe and share. That's all for now. Stay well.